Hi, I'm Dr. Packer with Precision Spinal Care, and I just wanted to share with you some realistic expectations when you go to a doctor that's going to treat you with any spine-related problems. Because it's very easy to have a certain set of expectations that maybe you should feel better right away, and if you do, the problem's solved. Or maybe you go for 2 or 3 visits, or maybe even 2 or 3 weeks, and you're not seeing the difference in what you were expecting. You may decide that it's not working at all. Unfortunately, I've seen that lead to people not getting results for years because maybe they didn't get something long enough or they wasted too much time in an office that wasn't able to help them. So one of the things that we lay out are these realistic expectations for patients is after a very thorough exam that's done, and everything should be based on an accurate diagnosis. Don't go somewhere where they just want to make assumptions and jump right into treatment. Everything should be based on a very thorough orthopedic, neurological, mechanical exam, imaging if necessary. The doctor needs to spend their time with you, listen to you, look at past medical records, look at past images that were done, and actually come up with a working game plan that makes sense with the pain that you're having. And then it should be on a short trial period. I say 30 days, meaning if the doctor makes recommendations to you, at least give the treatment 30 days. And then a re-exam should be performed. And the purpose of a re-exam is to be able to determine, is what we're doing working? Do we need to change anything? Do we need to order more images? Do we need to do other tests? Do we need to maybe change the frequency or the type of treatment that we're doing? And then are we done? Maybe the tests are negative at that point and the care is no longer medically necessary. So that's why I'm so adamant in my office that we not only do a thorough evaluation up front and not rush into treatment, but that we're going to do regular, thorough re-exams so you know exactly where you're heading on this journey. I've also seen on people's journey to getting better that the stress of life can get in the way, whether it be family emergencies coming up, traffic, financial stress, work schedules, getting in and out of your appointments on time. So it's so easy to let the hectic nature of life get in the way. And when we had really good intentions at first about getting something fixed, and maybe we're even seeing really good results, all of a sudden we don't make ourselves a top priority anymore and other things get in the way. So again, this is part of setting realistic expectations of time, not just to feel better, but to fix your underlying problems and see long-term results and help you avoid the pitfalls that can affect so many people of life getting in the way of taking care of yourself. Some other things that can get in the way of our journey is, again, this balance of trying to balance your desires to get better with keeping your appointments and staying on track with getting these results. Or it may just be a casual conversation, well-intentioned others, a friend, a family member. Maybe you read something online, you talk to another doctor, and all of a sudden you're pushed in this direction or that direction, and it can become confusing. So again, it's important to develop a really strong relationship with your doctor, that realistic expectations are set, any questions that you have. And one of the things that I like to do is give my patients a full report of their findings with explanations in layman's terms. That way, if you have a concerned person or somebody that really cares about you, you can share that information with them. And with your permission, I'm happy to speak to them on the phone, or you can bring them with you on a visit. I always reach out to your primary care doctor to let them know what's going on. So I do believe in a teamwork approach and helping you with the support that you need to get well. The biggest thing I encourage in my office is open communication, meaning I always want my patients to communicate their fears, their concerns, their challenges, so we can work together to overcome them and get the results that they came to see me for, whether that be being flexible with our schedule, working with your copay budget or your finances, answering questions or concerns that family, friends, or other doctors may have about your care. We are here to hold your hand, make this journey possible as a team, and get the results that you're looking for. So I never want my patients to feel like we're too busy or they can't pick up the phone and call me or take some extra time on one of their visits, because we can get these results working together. And in the end, I do my best so we can keep our eye on the ball, meaning getting you out of pain, getting you back to your everyday activities of daily life, the things that you enjoy in life, and getting your life back, not just temporarily while you're treating, but long-term results. So even when you stop coming in for regular visits, that you're seeing those results for years to come. And we're really adamant about your exit process of your treatment plan, that we prepare you to succeed on your own.